So my company is developing a breathing exerciser to help people recover from surgery. So whenever you get a surgery and stay in the hospital, there's a risk that you get lung complications just from being on anesthesia and then kind of laying there in the hospital. So they have you do these breathing exercises with this device 10 times per hour. There's like a little ball that floats up. You're supposed to do it 10 times per hour so that you don't get pneumonia. And unfortunately, a lot of patients don't do it as often as they're supposed to, or they do it incorrectly. So we're trying to develop a digital version of that device to remind the patients to complete the exercises as often as they're supposed to, give them live prompts and coaching, and then also track their progress over time, both for their own purposes and for the provider to see. The goal of this is to get it widespread to patients, as soon as we can. So to reach that goal, our first step is going to be running larger clinical trials to show that compared to the normal device, that this really improves the patient's outcomes. Then from there, we'll look to get it FDA approved towards the end of 2027, early 2028. And then after we get on the market, once we have our initial customers, that's when we would want to transition this to a distributor where they can really take it and run with it and get it out to all of the patients that they currently serve. My co-founder and I were both doing this right out of undergrad. So, not a lot of people get the opportunity to do a venture right out of college, but we had the right conditions where we had some very supportive funding right out of Penn and from the University City Science Center. And then we also had a clinical trial set up with Penn Med. So that allowed us to go straight from doing this in the classroom to doing it as a company after. It was a very gradual escalation of commitment from, we'll do this project as our idea, to we actually might be onto something here, to, we have a clinical trial set up and a bunch of funding from Penn. I guess we're doing this, and now we have an NIH grant and more trials set up. But it's so hard to do a venture that's the way that you have to think about it when you're so likely, unfortunately, to fail, is that you take it one milestone at a time, think about the biggest risk to your company, and if you can try to validate that and use your funding and get to that next milestone, then you're good and you keep working on it. So the biggest strategy that we use to take the idea from idea to more of a real concept would be talking to people. So you have to think about who might be involved in touching or using your product and figure out from them what matters. So we spoke to nurses and asked them to tell us about the standard of care. We spoke to respiratory therapists, the surgeons, the pulmonologists, people who purchase devices in the hospital, all of whom to kind of figure out, does this idea have any legs to it? Is this something that could realistically solve a problem and be purchased? Literally within the same conversation of a surgeon, we might go from I don't see complications that much, I'm not that worried, to wait, oh my God, that's amazing, can I trial it at my hospital? Literally within the same conversation. So it's definitely a mental roller coaster, and I think I would just tell my younger self to keep at it, that it's worth it.